Inherited CD59 deficiency is a rare disorder that manifests. Definition: Inherited CD59 deficiency is a rare disorder that manifests in childhood with recurring hemolytic episodes and severe neurologic symptoms. No specific treatment exists.
Deep inside the armor and protection of our skeletal system is our bone marrow, which is a soft tissue where blood and lymph cells are born from one common ancestor called the hematopoietic stem cell. This stem cell produces hundreds of billions of cells every day in the process that creates both daughter cells as well as new stem cells. And the new stem cells repeat the process over and over again, creating an endless and regenerative cycle. Daughter cells, on the other hand, are known as progenitor cells because they continue a process of multiplying and dividing into different types of cells. This process is known as differentiation, where each new type of progenitor cell continues to divide and multiply into new types of cells until finally reaching their full maturity and differentiation. There are three primary kinds of cells created in this process. They are red cells, white cells, and platelets. Our blood cells reach full maturity in the bone marrow before they migrate to the blood vessels and enter the bloodstream. But some white cells, such as T-cell lymphocytes, do not reach full maturity in the bone marrow, but instead migrate to the lymph nodes and thymus, where they continue evolving into fully mature and differentiated T-cells. Later we'll see how these cells are triggered to return to the bloodstream and help the other white cells fight off infections and other invaders.
CD59 is expressed on numerous cell types, including hematopoietic cells, endothelial cells, neurons, and neuroglia, and it regulates the complement system by inhibiting the formation of the membrane attack complex, a C5b9 complex that triggers endothelial damage, cytotoxicity, and neurodegeneration in vivo.
There's targeted therapy and traditional chemotherapy to treat cancer, but in some cases, the oncologists are combining both to help you get the best treatment possible. We find out more in today's Health Matters. When it comes to treating cancer, oncologists often have to choose between targeted therapy or traditional chemotherapy.
It's very important for patients to realize that this is very individual. It depends on their particular condition, their particular diagnosis, etc.
Targeted therapy is designed to stop potential problem cells from reproducing and forming tumors, while traditional chemotherapy can destroy both cancerous and non-cancerous cells. Certain cancers may cater to one therapy over the other, but in some instances, both might be required.
For example, pancreatic cancer. Pancreatic cancer is traditionally a difficult disease to treat, but the best option now is a combination of traditional chemotherapy plus the addition of a targeted therapy, a pill called Tarceva.
The idea of using both therapies is still evolving.
So we're trying to improve on that by doing clinical trials, and we currently have a clinical trial looking specifically at patients with pancreatic cancer, combining traditional chemotherapy with a new targeted therapy.
Combining both target therapy and chemotherapy could lead to improved treatments for other cancers.
We're combining a pill that is approved in myeloma and multiple myeloma, but we know that it has multiple functions. So while it is targeted, it may not be targeted to a particular type of cell in a particular type of cancer, but rather it's targeted to a particular type of abnormality which may be shared by several cancers.
Your personal position.
She was able to eat and swallow normally and stand and walk short distance with support. Her higher cognitive function increased considerably, her speech production and comprehension improved, and she spoke in whole sentences.
have Dr. Wendell Ross with us, who is our section editor for red blood cells in hemo today. Wendell, as probably most of you know, is the professor of medicine emeritus at Duke University, where he was previously also head of hematology and oncology, and was previously also president of the American Society of Hematology. Wendell, it strikes me that there are very few rational therapies that have come down the pipe in any field, medicine, certainly in hematology and oncology. The probably first exciting such rational therapy was the finding that a tyrosine kinase inhibitor, which we now call Gleevec, was remarkably and is remarkably effective in chronic myelogenous leukemia and also now in some gastric stromal tumors. You've had a lifelong interest in paroxysmal nocturnal hemoglobinuria, and it strikes me that this is really the second
In particular, since CD59 is an essential regulatory protein for the protection of human neuronal tissue, the role of complement and targeted complement inhibition warrants further investigation in neurologic disorder.